Basics of Medical Biochemistry. First edition, 2024. Chapter 20. Diet and Nutrition, Part 2 of 3. By Professor Dr. Muhammad Jawad. MBBS, Tao, M. Philosophy, Ph.D., Dip M.E. Head of the Biochemistry Department-Fazaia Ruth Pfau Medical College, Air University-PAF Base Faisal-Karachi-Pakistan. Ex-Professor of Biochemistry, Qassim University Kingdom of Saudi Arabia. Ex-Professor, Head of the Biochemistry Department and Vice Principal. Liaquat College of Medicine and Dentistry and Fatima Jinnah Dental College, Karachi, Pakistan. 20.5 Some important foods. Food has many varieties and offers a great range to choose from them. Different food has different nutritional values. One should select such food which is good for his health. Table 20.6 Types of foods. Bodybuilding food. Energy-yielding food. Protective food. Proteins. Carbohydrates. Fats. Vitamins. Minerals. 20.5.1 Milk. Milk is the lacteal secretion of mammals. As it is the only food of the young ones for a considerable period of their early life, nature has provided it with all the nutrients in an ideal proportion. It meets the nutritional requirements of adults too. Human beings usually consume human milk, cow's milk, buffalo's milk, and less commonly goat's milk. The composition of milk depends upon many factors including the period of lactation, species, age, nutrition, and physical and mental conditions. There is considerable individual variation too. The mammary secretion during the first 3 days after parturition is known as colostrum. It is yellowish, alkaline, and more viscid than mature milk. It is richer in proteins, minerals, lecithin, and cholesterol. The gamma globulins present in colostrum provide passive immunity to the newborn against a variety of infections. There is evidence that the newborn can absorb the intact gamma globulins. Colostrum gradually changes into mature milk in about 2 weeks, the secretion during the intervention period being known as transitional milk. Proteins of milk. Milk contains casein, lactalbumin, and lactoglobulin. All 3 proteins are of a high biological value containing all essential amino acids. Quantitatively, casein and lactalbumin are predominant. Their ratio is 3:1 in cow's milk and 1:2 in human milk. Casein is present as a salt, and calcium caseinate. Fats of milk. In milk, fat is very finely emulsified. It is mainly present as triglycerides containing a variety of fatty acids. Oleic and palmitic acids are the predominant fatty acids, human milk being richer in the former and bovine milk in the latter. Cholesterol and free fatty acids are present in small amounts. Carbohydrates of milk. Lactose is the principal carbohydrate of milk. Glucose and galactose may be present in traces. Lactose provides galactose to the developing brain for the synthesis of glycolipids. Inorganic components of milk. Milk is a good source of nearly all essential minerals except iron. Milk is rich in calcium, potassium, sodium, phosphate, and chloride ions. Magnesium and sulfur are present in smaller concentrations. Several trace elements are also present. Vitamins of milk. Milk is rich in vitamin A, riboflavin and pantothenic acid. Taking into account the vitamin stores received from the mother during intrauterine life and those synthesized by the intestinal flora, the only vitamins that need to be supplemented in the diet of an infant are vitamin C and vitamin D. Pasteurization of milk. It is the process of heating milk to 72 degrees Celsius for at least 15 seconds, and no more than 25 seconds, then cooled very quickly and kept cooled until delivered. Another method is to heat milk between 60 to 63 degrees Celsius for 30 minutes. Pasteurization makes sure milk is safe to drink by killing any pathogen and also helps to prolong its shelf life. By law, all milk sold to the public must be pasteurized and packaged in a licensed dairy plant. 20.5.2 Meat, chicken, and fish. These foods are regarded as a good source of proteins in large amounts. They are also rich in fats. They are the basic source of iron and vitamin B12. They also provide essential amino acids, essential fatty acids, vitamin A, zinc and iodine. Meat is deficient in calcium, vitamin C, and many members of the vitamin B complex. Fish oil is particularly rich in essential fatty acids. 20.5.3 Eggs. Egg is an excellent source of proteins. It is outstanding in its nutritional value for young ones and adults of all age groups. Egg contains good quality animal protein of high biological value. Hens and ducks' eggs are usually consumed as food. The total average weight of an egg is 60 g. Out of it, 10% is the shell, made up of cacao-3, 60% is egg white and 30% is egg yolk. 162 calories per 100 g of the egg are produced in the body. Eggs have brilliant regenerative effects on the body and therefore are recommended for the elderly. They can calm down and/or cure many diseases attributed to old age, deficiency, or excess nutrients in the body. The edible part, egg white and egg yolk, is composed of water 70 to 75%, proteins 12 to 15%, fats 10 to 11%, carbohydrates 1 to 1.5%, ash 1%. Egg white. Egg white is mainly composed of proteins. The proteins are ova-albumin, ova-globulin and ova-mucin. Ova-mucin gives a mucinous appearance to the egg. Egg white also contains a small amount of the protein, avidin, which binds with biotin and prevents its absorption from the intestine. Avidin is inactivated on boiling. Egg white also consists of carbohydrates and minerals like calcium, phosphorus, and iron. Egg yolk. Egg yolk mainly contains proteins, lipids, and minerals. Its water content is much less as compared to egg white. The proteins are ovavitelin and ovaglobulin. The main lipid is lecithin, which is combined with vitelin to form lecithivitelin. Other phospholipids, cholesterol, and glycerol are present in smaller amounts. The chief minerals are calcium and phosphate. Small amounts of vitamins A, D, E and B complex are also present. The effect of cooking on the egg is beneficial and helps to inactivate avidin, slow the rate of the absorption of cholesterol, thus hypercholesterolemia is checked, kill the bacteria, thus egg-borne infections like salmonella do not infect the persons, otherwise, the infection of salmonella is very dangerous. 20.5.4 Cereals. Important cereals include wheat, rice, maize, barley, oats, etc. The outer covering of wheat is an indigestible fibrous layer beneath which lies another layer called alurone. Alurone covers the cells, rich in carbohydrates, proteins, and to some extent fats, minerals and vitamin B. Whole wheat flour is prepared by milling dried wheat. During milling, part of the outer layer is discarded as bran. Whole wheat flour is composed of water, 10 to 15%, carbohydrates, 70 to 75%, proteins, 8 to 10%, fats, 0.5 to 1%, and minerals, 1 to 2%. Carbohydrates of wheat. The chief carbohydrate is starch. Cellulose is present in smaller amounts, mainly in the outer envelope of the grains. Proteins of wheat. The proteins found in wheat are gliadin and glutenin, together called gluten. Lipids of wheat. The main lipid is triglycerides and different oils. However, wheat flour is poor in fat. Minerals and vitamins of wheat. Calcium and phosphate are the most abundant minerals. Phosphate is partly found as inositol hexaphosphate, phytic acid, which cannot be absorbed from the intestines and also impairs the absorption of calcium by forming insoluble calcium phytate. A small amount of vitamin B complex and vitamin E are present mainly in the outer part of the grain. Wheat flour is prepared by removing the outer layer of the grain. It is, therefore, poor in vitamins. Some cellulose, which adds roughage to the diet, is also lost. When the bread is eaten with honey in the morning, it is specially effective for bleeding piles, epilepsy, insomnia, impotency, high blood pressure, diabetes, and tuberculosis. 20.5.5 Butter. It acts as a body coolant and makes the food palatable and satiety. The butter nourishes body tissues and increases body energy levels. The complexion of the skin and strength of the body increases when butter is consumed routinely. Butter also increases appetite. 20.5.6 Nuts. They are rich in monounsaturated fatty acids, about 72%, like oleic acid, and an excellent source of all important omega-3 essential fatty acids like linoleic acid, alpha-linolenic acid and arachidonic acids. They also provide vitamin E in appreciable amounts. Important examples of nuts include macadamias, cashews, almonds, and walnuts. Cashews are very high in iron, zinc, and magnesium. Brazil nuts are an excellent source of selenium, which can help prevent cancer. Macadamia nuts contain more heart-healthy monounsaturated fat per serving than any other nut. Regular intake of walnuts in the diet help in lowering total as well as LDL or bad cholesterol and increases HDL or good cholesterol levels in the blood. 20.5.7 Green leafy vegetables. Green leafy vegetables are rich in vital nutrients required for human health and well-being, thus regarded as an important part of a healthy diet. They provide vitamins, minerals, and fiber but are low in calories. Eating a diet rich in leafy greens can offer numerous health benefits including reduced risk of obesity, heart disease, high blood pressure and mental decline. Kale and watercress like spinach, collard greens, leaf lettuce, and arugula are important examples of green leafy vegetables consumed by the majority of the human population. Vegetables contain cellulose, which increases stool mass, eases passage, and reduces transit time. Many of them are high in vitamin K. Without these, vegetable peoples are more prone to digestive disorders such as constipation, hemorrhoids, and diverticulosis. Vegetables also have significant socio-economic benefits. 20.5.8 Potato. Potato is a rich source of starch. This is a stem tuber and is a more commonly used food vegetable. It is necessary to cook potatoes to make starch edible and digestible. The carbohydrate content of potatoes is high, protein content poor and fat content negligible. The carbohydrate is present almost entirely in the form of starch. Its concentration is nearly 20%. The chief proteins are globulin and tuberin. The concentration of protein in potatoes is about 1.5%. Some free amino acids are also present. The vitamin C content of potato is appreciable but its concentration declines on storage. Potato consists of starch granules surrounded by an envelope of cellulose. If a raw potato is eaten, it will pass through the digestive tract as such without yielding any calories and appear undigested in the feces. Raw potato has therefore no food value. If the potato is heated, then the cellulose envelope bursts and the content is then available for digestion and production of calories. One medium-sized boiled potato gives nearly 83 calories. 20.6 Nutrition during pregnancy. During pregnancy, the baby uses nutrients from the mother's blood to develop tissues, bones and organs. Women who have a healthy diet during pregnancy are more likely to have a baby that has grown and developed properly. Good nutrition sets the foundation for life throughout pregnancy and beyond for both the mother and her newborn baby. The ultimate goal of providing a healthy diet during pregnancy is to establish a healthy pregnancy, which proceeds without physical or psychological pathology in the mother or fetus and ultimately results in the delivery of a healthy baby. An idea established by several studies over the past decade, fetal origins of adult disease, suggests that term infants who are small for their gestational age are predisposed to obesity and have an increased susceptibility to cardiovascular disease and type 2 diabetes in adulthood as a consequence of physiologic adaptations to undernutrition during fetal life. It is well established in the literature that, besides smoking, low birth weight is related to low maternal pre-pregnancy BMI and low gestational weight gain. Low pre-pregnancy BMI and low gestational weight gain reflect inadequate food intake, which may be related to poverty or the inability to acquire a sufficient amount of food, in addition to cultural ideals of thinness and beauty in many developed countries. Table 20.7 Role of nutrients in pregnancy. Nutrient functions in the body. Protein, regarded as the main building block for the synthesis of body cells, helps produce extra maternal blood and energy stores. Carbohydrate, provides energy for mother and fetus during pregnancy. Fat, provides long-term energy for growth. It should be taken in such amounts to contribute 30% of daily calories. Essential fatty acids, EFAs. Incorporated into the central nervous system, brain, and tissues of the fetus. Essential for proper brain growth and development. Vitamin A. Supports healthy skin and mucous membranes of the gastrointestinal, urinary, and respiratory tracts. Promotes vision and immunity. Helps with bone and tooth growth. Vitamin C. Keeps gums, teeth, and bones healthy. Enhances iron absorption and acts as an antioxidant. Vitamin E. Prevents the oxidation of unsaturated fatty acids, which are involved in the development of cell membranes. Vitamin B6. Supports the production of red blood cells. Required for amino acid metabolism, fatty acid metabolism and protein synthesis. Vitamin B12. Aids to produce red blood cells. Helps normal growth and maintenance of the nervous system. Folic acid. Required for the production, repair, and functioning of DNA. Necessary to produce blood. Helps some enzyme action. Calcium. Aids to build strong bones and teeth by promoting adequate mineralization. Regulate muscle contraction and relaxation. Nerve functioning, blood clotting and immunity. Iron. Required for the production of red blood cells. Helps prevent maternal fatigue. Needed by enzymes that make amino acids, collagen, and hormones. Magnesium. Helps to build strong bones and teeth. Helps to regulate insulin and blood sugar levels. Helps maintain acid-base balance. Zinc. Involved in the formation of the skeleton, nerves, and circulatory organs. It is a component of several enzymes. Supports the synthesis of DNA, RNA and proteins. Necessary for wound healing. Minerals participate in diverse tasks all over the body. During pregnancy, some of the most important tasks involve bone growth and development as well as organ system development. Folate has considerable significance during pregnancy. It is one of the types of the vitamin B complex that can prevent certain birth defects of the brain and spinal cord during the first months of pregnancy. Pregnant women need about 600 mg of folate each day. Folate is usually added to enriched bread, cereal, pasta, and rice. It is also found in broccoli, spinach, dried beans, peanuts, lean meats, and orange juice. Quality and timing of diet in the first trimester of pregnancy. Both the amount of a nutrient and its timing of intake are extremely important to fetal development. The first trimester is a time of rapid cell division, organ development, and preparation for the demands of rapid fetal growth that occur later in pregnancy. Critical nutrients during this phase include protein, folic acid, vitamin B12 and zinc. Quality and timing of diet in the second and third trimester of pregnancy. During the second and third trimesters, energy intake is especially important since 90% of fetal growth occurs during the last half of gestation. Critical nutrients during this phase include protein, iron, calcium, magnesium, members of the vitamin B complex, and the omega-3 fatty acid. Energy needs during pregnancy. Extra energy intake is required by healthy pregnant women to support adequate gestational weight gain and increases in basal metabolic rate. Among normal weight women, it has been shown that energy requirements increase negligibly during the first trimester, by 350 kilocalories per day in the second trimester, and by approximately 500 kilocalories per day in the third trimester. However, there is great variability among pregnant women about individual energy costs during pregnancy related to differences in body size and lifestyle. Therefore, appropriate weight gain and appetite are better indicators of energy sufficiency than the number of kilocalories consumed. Gestational weight gain patterns. Unfortunately, only 30 to 40% of women gain weight within the recommended ranges during pregnancy. Thus, the majority of women in the U.S. gain either too little or too much weight during pregnancy. In fact, when more weight is gained than is necessary during pregnancy, this contributes to postpartum weight retention, which is problematic given that 65% of U.S. adults are overweight or obese. Weight gain is normal during pregnancy. Weight before pregnancy helps to determine how much weight to gain. The following recommendations are considered regarding weight gain during pregnancy. Women who are underweight need to gain 28 to 40 pounds. Women who are at a healthy, normal weight need to gain 25 to 35 pounds. Women who are overweight need to gain 15 to 25 pounds. Women who are obese need to gain 15 to 18 pounds. Women normally gain 2 to 4 pounds during the first 3 months of pregnancy and 1 pound each week after that. Pregnancy is not the time to go on a diet or lose weight. Conditions causing inadequate nutrient intake and weight gain during pregnancy. Many factors may influence dietary patterns during pregnancy. Common conditions that may result in inadequate nutrient intake and weight gain during pregnancy include the following: nausea and vomiting, heartburn, constipation, food aversions, most commonly alcohol, caffeinated beverages, and meats. Food avoidances, most common milk, lean meats, and liver. Poor pre-pregnancy diet, such as inappropriate dietary patterns, a history of frequent dieting, weight cycling, and/or eating disorders. Excessive physical activity, though less common, may also contribute to inadequate weight gain during pregnancy. Conditions causing excessive weight gain during pregnancy. Some common conditions may result in excessive weight gain during pregnancy. These include food cravings, which are most commonly dairy and sweet foods. Psychological influences on eating behavior, such as reduced attempts to control food intake and the finding that pregnancy legitimizes eating more. Reductions in physical activity due to pregnancy complications, physical discomfort, and increasing body size may also contribute to excessive weight gain during pregnancy. The risk of being overweight due to excessive pregnancy weight gain needs to be balanced against the risk of poor fetal growth associated with inadequate weight gain. In addition, the extra kilocalories consumed and the overall maternal diet needs to be nutrient-dense to supply sufficient nutrients to the developing fetus, since fetal demands may double some micronutrient requirements. An extra 300 to 500 kilocalories, which is required during the second and third trimesters of pregnancy, might seem like a lot of food, but it does not equate to very much. Energy and nutrient needs continue to be elevated postpartum, particularly in women who choose to breastfeed or who have had a cesarean section. The energy required for daily milk production is close to 560 kilocalories. Table 20.8 Type of meals to get additional 300 kilocalories during pregnancy. 300 kilocalories meal equivalents. Nutrients supplied: 8 ounces of low-fat yogurt, sweetened, a medium apple. Protein, carbohydrate, fiber, vitamin B12, calcium. Whole wheat pita bread, 1/4 cup hummus, 12 baby carrots. Protein, carbohydrate, fat, fiber, vitamin A, vitamin B6, vitamin E, folic acid, iron. 1 cup raisin bran, 6 ounces skim milk, 4 ounces orange juice. Protein, carbohydrate, fiber, vitamins B6, B12, C, folic acid, calcium, iron, magnesium, zinc. 2 slices whole wheat bread, 1 tablespoon peanut butter, 1/2 banana. Protein, carbohydrate, fat, fiber, vitamin B6, vitamin E, folic acid, iron, magnesium, zinc. 4 ounces salmon, medium sweet potato, 1/2 cup steamed broccoli. Protein, carbohydrate, fat, omega-3, fiber, vitamins A, C, B12, E, folic acid, magnesium. Control of morning sickness during pregnancy. During pregnancy, many women experience morning sickness. The following suggestions are helpful to prevent nausea and vomiting. Eat crackers, toast or dry cereal before getting up in the morning. Eat smaller, more frequent meals that are high in carbohydrates and low in fat. Limit fried, fatty, and spicy food. Drink liquids between meals. Eat a small snack before bedtime. Sleep in a well-ventilated room. Eating care during pregnancy. a healthy diet is the best way to get the nutrients needed during pregnancy. Pregnancy is a dangerous time to take large doses of single nutrients since some of them can cause problems with the developing baby. Harmful substances like tobacco, alcohol, and drugs cross the placenta during pregnancy and can cause birth defects and other disabilities. They can also cause deficiencies in important nutrients. Complete avoidance during pregnancy is the best protection. Smoking during pregnancy can cause premature births or stillbirths. Premature babies often have complications after they are born and have a lower survival rate. Using alcohol during pregnancy increases the risk of having a miscarriage, a low birth weight baby, or a baby with fetal alcohol syndrome.
Table 20.9 Deficiency of micronutrients and pregnancy outcomes. Deficient micronutrient. Pregnancy outcome. Folic acid. Neural tube defects.
Iron.
Anemia and hemorrhage. Iodine. Cretinism. Calcium. Hypertension and preeclampsia. Zinc. Anemia, neural tube defects, low birth weight. Encephalopathy.
Vitamin A. Vertical transmission of HIV, reduced infant survival. Maternal anemia, infection, maternal mortality.
Vitamin D. Neonatal hypocalcemia. Vitamin K. Hemorrhage. Magnesium. Increased blood coagulability, toxemia, preterm birth. Copper. Anemia, encephalopathy, low birth weight. Selenium. Neural tube defect, dysfunction of the brain and cardiovascular system, abortion.
20.7 Respiratory quotient, R.Q. The ratio of the quantity of carbon dioxide produced to the quantity of oxygen consumed per unit of time is known as the respiratory quotient. CO2 produced. O2 consumed. Significance. Represents the oxidation reaction of various kinds of food or substrate. Reflects the metabolic rate of an organism. The respiratory quotient of most animals at rest is in the range of 0.8 to 0.9. The human respiratory quotient is about 0.85. The values of the respiratory quotient of glucose and protein are 1.0 and 0.8 respectively. There is no single R.Q that can be assigned to the oxidation of protein in the diet because of the complexity of the various ways in which different amino acids can be metabolized. However, 0.8 is frequently used. The respiratory quotient of fat is 0.7, but it may vary depending on the type of fat. A respiratory quotient equal to or smaller than 1 indicates aerobic respiration. A respiratory quotient greater than 1 indicates anaerobic respiration. Table 20.10 Respiratory quotients of some common foods. Substrate. Equation. R.Q. Glucose. C6H12O6 plus 6O2 rightward arrow 6CO2 plus 6H2O. 6CO2/6O2 equals 1.0. Fat, palmitic acid. C16H32O2 plus 23O2 rightward arrow 16CO2 plus 16H2O. 16CO2/23O2 equals 0.7. Protein, albumin. C72H112N18O22S plus 77O2 rightward arrow 63CO2 plus 38H2O plus SO3 plus 9CO, NH2, 2. 63CO2/77O2 equals 0.8. Respiratory exchange ratio, rare. It is the proportion of CO2 volume generated to the O2 volume consumed at any given time. The rare under typical metabolic conditions with stable respiratory function ranges from 0.7 to 1.0. When rare is lower than 0.7 or higher than 1.0, lengthy starvation or too much recent energy consumption should be suspected. 20.8 Basal metabolic rate, BMR. It is the minimum amount of energy required by the body to maintain life at complete physical and mental rest in the post-absorptive state. This energy expenditure of cells is necessary to perform vegetative processes of living, example respiration, circulation, digestion, excretion, secretion, synthesis of special substances, nerve conduction, ion transport across the cell membrane, keeping body temperature at 37 degrees Celsius, growth and repair. BMR is measured in kcals per square meter of body surface area per hour. 20.8.1 Measurement of BMR. BMR can be measured by the apparatus of Benedict-Roth, closed-circuit device, or by the Douglas-Bag method, open-circuit device. During measurement of BMR, the subject should be awake, at complete physical and mental rest, and in the post-absorptive state, i.e., he/she should not have taken anything by mouth for the past 12 hours and in comfortable surroundings. The volume of oxygen consumed by the subject for 2 to 6 minutes under basal conditions is determined. The R.Q of a subject under basal condition is 0.82, at which 1 liter of oxygen produces 4.825 kcals. The surface area of the subject can be found by any of the following methods. 1. By Dubois and Dubois formula, body surface area, M2, equals, weight in kg, 0.425 times, height in cm, 0.725. 2. By nomogram. By this method, the point obtained on the middle vertical line, which is transected by a line joining the subject's weight and height, gives the body surface area. Figure 20.1 Benedict-Roth device for the measurement of BMR. Figure 20.2 nomogram to find out surface area from height and weight. Harris-Benedict method to calculate BMR. There are 2 formulae, one for men and one for women, used to calculate BMR in kcals/day. 1 BMR for men equals 66.47 plus 13.75 times weight in kg, plus 5.00 times height in cm, 6.76 times age in years. 2 BMR for women equals 655.1 plus 9.56 times weight in kg, plus 1.85 times height in cm, 4.68 times age in years. The BMR values obtained by the above methods have to be multiplied by factor 1.1 in subjects free from any stress, 1.4 in subjects under stress, and factor in between 1.1 and 1.4 in subjects who are in between the 2 states of stress-free and stressful conditions. 20.8.2 Standard values of BMR. A BMR value between 15% and plus 20% is considered normal. Adult man equals 35 to 38 kcals/m2/hour. Adult woman equals 32 to 35 kcals/m2/hour. Table 20.11 Standard values of BMR in kcals/m2/hour. Age, years. Men. Women. 14-15. 46.0. 43.0. 16-17. 43.0. 40.0. 18-19. 41.0. 38.0. 20-29. 39.5. 37.0. 30-39. 39.5. 36.5. 40-49. 38.5. 36.0. 50-59. 37.5. 35.0. 60-69. 36.5. 34.0. 70-79. 35.5. 33.0. 20.8.3 Factors affecting BMR. 1. Surface area. BMR is directly proportional to the surface area. 2. Sex. Men have approximately 5% higher BMR. 3. Age. In infants and growing children, BMR is higher. In adults, BMR decreases at the rate of 2% per decade of life. At 60 years of age, it becomes 10% less than that at 20 years. 4. Physical activity. BMR increases with regular exercise. Sports persons have higher BMR than sedentary workers. 5. Sleep. BMR is 10% lower during sleep than waking time. 6. Pregnancy. BMR is increased in pregnancy, particularly in the third trimester. 7. Hormones. Thyroid hormones increase BMR significantly. Epinephrine, cortisol, sex hormones, and growth hormones also increase the BMR. 8. Environment. Exposure to cold causes muscle shivering. That's why BMR is higher in cold climates compared to warm climates. 9. Starvation. Starvation causes a decrease in BMR by up to 50%. 10. Fever. Fever increases BMR by the rate of 10% increase for every 1°C rise in body temperature. 11. Disease conditions. BMR is elevated in infections, leukemia, cardiac failure, anxiety, neurosis, hypertension, etc. 12. Drugs. Certain drugs like dinitrophenol, DNP, increases the BMR by interfering with oxidative phosphorylation. 20.8.4 Significance of BMR. BMR is important to calculate the caloric requirement of an individual and diet plans. It is helpful in the assessment of thyroid function. It is below normal in starvation, undernutrition, and Addison's disease. It is above normal in fever, diabetes insipidus, leukemia, and polycythemia. End of Part 2 of 3 of Chapter 20. Thank you.